and welcome to Des Moines University Clinic. My name is Ashley Dykes, and I'm a doctor of podiatric medicine and surgery. I'm really excited to be a part of the Des Moines University Foot and Ankle Clinic, involved in our teaching facility as we help to educate this next group of healthcare providers. I'm originally from the Midwest and grew up running and enjoying being outdoors. So as someone who treats the foot and ankle and is an avid runner myself, I can appreciate the importance of keeping your feet happy and healthy. Today I'm going to talk with you about one of the most common conditions affecting runners, which is plantar fasciitis. Plantar fasciitis is one of the most common conditions that we treat here at the DMU Foot and Ankle Clinic, both in the general population as well as in runners. So let's review the anatomy of the plantar fascia so we have some idea of what we're dealing with. Plantar fascia is a thick piece of tissue that extends along the bottom or plantar surface of the foot. It helps to support the arch. It originates at the plantar surface or bottom of the heel bone, the calcaneus, extends along the arch, and spreads out here at the ball of the foot. It's thick, strong, similar to celery, long and stringy. And its main job is to support the arch for walking or running. Here at the heel bone is where it tends to cause the most discomfort and where people develop the most symptom, here where it attaches to the plantar surface of the heel bone or the calcaneus. Symptoms of plantar fasciitis include pain with first few steps out of bed in the morning, as well as pain upon standing after you've been sitting for a period of time. Early on, these symptoms are brief and seem to improve with activity, but as time progresses, you can begin to experience pain throughout the day. This is a condition that is best treated when it's caught early on. If we let symptoms progress, we can begin to have pain that is much more difficult for us to deal with and difficult to treat. Treatments for plantar fasciitis are multifactorial. There's a couple things that we throw at it in hopes that we can get that pain to resolve. And in most cases, it does. Initial treatment involves stretching. Stretching is the most important thing, and oftentimes something in the running population that we tend to forget. Things like stretching, doing the traditional runner stretch with hands against the wall, stretching the back of the leg along the Achilles tendon and the calf. These are the stretches that focus on the plantar fascia and help us to alleviate that discomfort. Other treatments involve non-steroidal anti-inflammatory medications, over-the-counter medications such as Aleve or ibuprofen, as long as these are safe for you to take. We'd always want to check with your primary care physician before proceeding with any kind of medications. Adjusting shoes, also use of orthotics. Over-the-counter orthotics are a great option for management of plantar fasciitis. You want something that's got a thick, sturdy plastic insole as opposed to simply just a cushion. We want to make sure we give that plantar fascia good support, and again, that helps relieve the symptoms. Typically, ice is another thing that we'll try. People will talk about putting a water bottle in the freezer and then rolling your foot over it. That's a really helpful way to decrease inflammation and help with pain. Plantar fasciitis forms, we think, due to repetitive trauma. This often is seen in runners as we have that foot hitting the ground numerous times. Again, as I said, this is a condition that is treated best when it's caught early. Oftentimes, it's something that's not just cured, but more controlled. And the best way to control it is with stretching and some of the other modalities we've talked about so far. Another way that's really helpful for us is often to refer to our colleagues in physical therapy, which can be done here at the Des Moines University Physical Therapy Department. Here at DMU, there are other treatments that we can offer beyond these at-home remedies. If you're still experiencing pain after trying some of these other treatment options, things we can try are steroid injections, in addition to physical therapy, and oftentimes we're going to obtain an x-ray or do an exam in order to make sure that we can rule out other causes of heel pain. If plantar fasciitis persists, there are other treatments such as surgery that oftentimes can be helpful but are rarely needed. For the running population, our main goal is prevention. We want to make sure that you never have to deal with plantar fasciitis, and the best way to do that is with a good stretching regimen. We're always happy to help here at the Foot and Ankle Clinic with any questions related to both prevention as well as treatment of heel pain, in particular plantar fasciitis.